Good day, folks. Alfie Vente here once again at Vente Pain Relief Clinic and VPRC.ca. I'm hoping you're having an amazing new year. Welcome to 2025. This is our first video of the new year, and we are hoping that your start of this new year has been terrific. So today we're going to talk about 3 local muscles that can cause lower back pain. So of course there's more than 3, but these are 3 common ones that I look at generally when people come in with lower back issues. So let's start. The first muscle we're going to look at is the erector spinae group. So it's a group because there are a bunch of different muscles that run from your sacrum, your lower back, all the way up to the base of the skull. These muscles can become very, very tight, especially if if there's an imbalance between the front muscles, the front side of your body, and the back. Generally, what happens is these muscles become overworked, and then they become very tight. You can get trigger points. You can see here I've marked these X's, but this is under the skin so that you have an idea where these muscles lie under the skin. And you see these 2 X's here. Those are common areas where I'll work on to help relieve lower back issues. Again, you'll have this muscle become super tight when there's an imbalance between the front side, for example, your hip flexors and your abdominals, and this is typically from sitting for prolonged periods. So that's the erector spinae group. Let's look at the second one. The next common muscle that I see is the Quadratus Lumborum muscle. This is a very deep muscle. As you can see on the picture on the left, this is the rear view, so that's the back side of the back, and well, there's no front side of the back, but anyways, it's the rear view, and there's a side view of the muscle there. And this muscle can become very tight if someone's seated for prolonged periods while leaning to one side. So if you're one of those individuals that tends to lean on the right side or the left side, this muscle can become very tight. In fact, I see a number of cyclists coming in with Quadratus Lumborum tightness, because what happens is when they're cycling, they tend to hike up one hip over the other, because this muscle, what it does is it actually stabilizes the hip and also hikes the hip up as one of its actions. So a clue for me that tells me that it's probably Quadratus Lumborum is that not only is there pain locally around the lower back, but there will be referral pain into the hips. So I might notice that, or the person might complain about hip pain, glute pain, along with lower back pain. So it's potentially the Quadratus Lumborum muscle, along with me noticing that there's a lot of tightness on the one side, and maybe they're leaning to one side while they're standing, or even when they are lying on their stomach. I'll notice one side seems to be higher than the other. So this is Quadratus Lumborum. The final muscle that's very common that I see that may cause potential lower back pain is the latissimus dorsi muscle. And generally, this is not a muscle that one will look at in rehab in regards to potential lower back pain, but I do. And the reason for this is because anatomically, if you look at it, you see this sort of whitening, this white area here. This is a thickening of tissue, a thickening of tendinous tissue called the thoracolumbar fascia. Obviously, the red fleshy thing here is the lat muscle. And the lat muscle actually attaches to the front of the shoulder, along with attaching to the thoracolumbar fascia, which also has the glutes attaching to it. So what happens is when one side becomes very, very tight, it can pull on that thoracolumbar fascia, causing a lot of pain and tightness and discomfort in the lower back. And there are pretty much 3 ways that this latissimus dorsi muscle can become very tight. Number 1, excessive pull-down type of exercises. So somebody who does, for example, chin-ups even, if they're doing a lot of that without much stretching, the lat pull-down exercise without much stretching, they're doing that excessively, this muscle can become very tight. In fact, if they are pulling more with one side will become tighter and potentially cause issue on that side that they're using too much of. The second one is, I see this a lot with parents that have newborns, especially if they're carrying the newborn on one side, say like the right shoulder, they're kind of lifting with one side as one of their habits, and they don't like exchange left and right. That muscle can become very tight. Finally, climbing activities, and this goes along with that excessive pull down type of exercises. I do have climbers and also people that do bouldering, and when they're doing a lot of this pulling type of motion, this lat muscle can become very tight, potentially causing lower back issues. Now, A way that I can figure out that it's probably lat, along with just sort of like the tightness locally in the area, is that the person will show that their right shoulder or left shoulder, depending on what side is causing what side's more painful, is that it'll roll more forward than the other. So if I see this, that's a big clue for me to tell me that it's probably the lat that's causing the person's issue in the lower back. So local tightness, complaining of the lower back, along with the rounding of the shoulders forward, that can give me clues in regards to the lat being the potential cause for the chronic issue. So, what can deep tissue massage do? So what it can do, there's a number of things. We can work deep into the tissues to access deep muscles that could be the root cause, especially those muscles that are potentially the chronic, that are chronically tight. We can access those muscles because of the aggressive techniques that we use. Like for me, I don't believe that you can go in and work on deeper structures just by sort of being soft on tissues. So for me, it seems physically impossible to do that. Although some will argue that there are some techniques, and there are some techniques that may access those deeper fibers. But for me, what I've noticed over time is that the aggressive work with my elbows, with my forearms, with my knuckles, tends to help relax those tissues that are chronically tight, and that are deep. Also, we can decrease trigger point activity. As I mentioned, the quadratus lumborum muscle, not only does it cause local pain, but it can also refer into the hips or the glutes. So I can access those trigger points in the quadratus lumborum muscle to help relieve some of the pain that the person might be also encountering with the hip and the lower back, and that's what we can do. Also, relax tissues to help improve joint mobility. This is ultra important because if a joint is not moving well, if it's stuck, what will happen is that you'll have other joints above and below that will be moving excessively because there's lack of motion, so it's compensating for the lack of motion. And when that occurs, those joints and the muscles around it can become spasm because there's that excessive motion, so the body's trying to stabilize that region. And finally, relieve pain. So because of all these three things that I talked about in terms of what deep tissue massage can do, it can definitely relieve pain. Initially, what will happen is that when we work on the area, it'll be sore for a couple of days. But over time, as we do a set of treatments, the person should notice that the muscles are feeling more relaxed. There's definitely like a diminishment of pain, and the symptoms are better. So there you go. What can deep tissue massage do? So we want to thank you for watching this video. We really, really appreciate it. Please like, share, subscribe, and hit that notification bell if you are on YouTube, especially if you do enjoy our content. Follow us on our social media. Visit our websites. We have ventepainrelief.com, which is our clinic website. We also have vprc.ca, which is our pain relief fitness website. We give you tips on managing your pain while you're doing your fitness routines if you're encountering pain. If you've got any questions, please feel free to give us a call at 416-644-8894. That is our clinic number in downtown Toronto, Financial District, King and Bay, First Canadian Place. Also, you can email us at admin@ventepainrelief.com. Have yourself a great day, and we will see you in the next video. Again, Happy New Year, and thank you for watching the video. Take care.